Hey guys, it's January 8th. Just a few more days to surgery. I'm actually feeling pretty good about it. I don't know why. I mean, it's funny, my husband gave me a little bit of truth that I didn't even know about, because apparently he told me that like your whole chest cavity is like immersed in saline. And I'm like, why is he watching open heart surgeries? Like, how did he know that? And I asked him, I was like, why are you watching these surgeries? They're horrible. Like, I don't know. I've not known him to like go research anything in terms of my condition or even like the process of everything. And he's like, no, the surgeon told me you would probably be swelled because of that. And I was thinking about it, and I was like, yeah, it totally makes sense, because if you're open for 16 hours, obviously they have to keep everything wet or to dry and shrivel up. And that's just really weird. And I don't know why I never thought about it. But I've been thinking about it lately, and it's kind of freaking me out a little bit. But it's fine. I just feel like this one, because I don't have the shoulder pain, I'm telling you, it's funny because the surgeon, I remember like telling you guys, he was like, well, we usually find that when we go in, it's a little more numb each time in terms of the chest plate. And I was like, no, it's not. But I don't think that that's what I was feeling. I think I was feeling the shoulder pain. So I'm actually kind of excited to actually get out of this and maybe not have as much pain. Obviously, messing with the heart, and there'll be some internal bleeding, obviously. They'll probably do a CT scan. No, not before. They'll do one after, just to check on the progress of everything. And I have to keep myself super calm. I have to keep my husband super calm. Obviously, this is very stressful, and someone needs to give him an award, because the amount of stuff this man has been put through because of me is just outrageous. I mean, anyone lesser would have left, just because it's incredibly difficult. And I hear all the time about people where their just partners leave them, their husbands, wives leave them because they're going through really catastrophic health problems. And it takes like a real man and like a real adult to be able to handle this and not freak out and just leave, or kill themselves, I guess. I don't know. It's not like I expect that, but geez, this is just really hard. I can kind of tell it's kind of taking a toll, because I ask him to bring me little things every day, and I think it's kind of stressful. But there is a pet therapy tomorrow, so I'm having him bring goggles and a mask for me, which I may do. I'm not going to do it without the goggles and the mask, obviously. And obviously I know how to wash my hands and all that stuff, and protect myself so that everything else is good. And I just need to, again, respiratory virus. That's what I need to protect myself from. And I really kind of want to go play with little puppies, because I think they actually bring puppies. And puppies are the best. And I've wanted a new puppy for years, but I don't think it's smart to do to like take on a new pup, obviously for me now. And especially in our apartment. To train a puppy to not be, I just wouldn't do that to my landlord. So I'm feeling pretty okay. Having like a few hot flashes. I'm a little annoyed because they told me to bring my supplements. And then they told me, well, these are all fine, but we don't want you to take them here. I'm like, well, then why did I bring them? So unfortunately, I have to send them back with him again. He doesn't know that yet, so whoops. It's just a bag he brought. He's going to be able to carry it out, but it's still kind of annoying, I realize, for him to be hauling things back and forth and then just be like, oops, kidding. So, oh well, it'll be fine. I was worried about my voice continues to get a little degraded with each one of those breathing tubes in and out. I already had that vocal cord paralysis. This one should not be an issue in terms of the vocal cord paralysis, I don't think. But obviously, it's just like the continued in and out of those freaking breathing tubes is making this a little hard in terms of the recovery. It'll be okay. I really feel very positive about this. I probably will get a little scared. It's unfortunate, I really haven't heard a whole lot from extended members of my family, and that's fine, because I tend to take the oxygen out of all these situations, because I'm the one that's always sick, so no one else is allowed to feel ill, and I don't really feel like that, but I understand that that's how they feel. So I've just been trying to be cool with it and just work on myself, work on my attitude, and really just try to overcome all of this, because it is so hard. I know I try to make it look easy. It's really not. I cry a lot. I haven't in the few days. I'm trying not to, because I'm just trying to go into this like just expecting the best and being able to see past everything so I can get the heck out of here. I want to go home and see my dog and be with my husband. Anyway, that's my update, and I will talk to you guys later. Thanks for checking me out. Bye.